Okay, Jug Coker, you're first on the agenda.
Good afternoon. I am here today to talk about the pretrial release grant and also provide an update to Commissioner's Community Navigator grant that we received from the Community Foundation, which is something we're really excited about. The pretrial grant is the grant that we have been utilizing 2019. That deals with Criminal Rule 26. That's the statute that requires that we have a pretrial release program. We were fortunate because we got in early enough that we have received DOC funding every year since it started, and so we are getting ready now to resubmit that grant for the next year. And that's the grant that pays for the staff's salary as well as for benefits. So I can leave you. And so I can explain to you some of the information if you need me to do that in terms of what the breakdown is, and Ms. Ruff can answer questions as well regarding that grant.
Okay.
Question?
When was the first year for the grant?
2019, I believe, was when we started. Yes.
Any questions?
I do not.
Okay, so the only thing that we are asking for today is signatures from the commissioners with regard to the letter that we submit with our DOC grant supporting, indicating that the commissioners support us. So I'll let that.
Well, Mr. McClure is ill tonight, so he will not be with us.
Okay.
Okay.
We can track him down.
Okay.
Okay, the other thing I wanted to update everyone on, and I, right, is here as well, and so I wanted to include her in that. We had, Superior Court, we had requested and written a grant to the Community Foundation, what we are calling a community navigator. And this is an individual who is going to be based out of Superior Court, but will serve the needs of the entire community. And so we did receive, or we were the recipients of that grant from the Community Foundation, I believe the amount of around $43,000. And that has been used to hire an individual by the name of Katie Surma. Some of you may already be familiar with Katie. She is local here. She worked for First National Bank for some time. She works also with Recovery Cafe out of Fulton County. And then she works with Intrepid Phoenix, which is a program for individuals who are in recovery. And what her responsibility is going to be is connecting individuals who need treatment for mental health or substance use to those providers that are in our communities, surrounding communities, getting individuals who may be incarcerated and need inpatient once they are released into those inpatients. She's also going to be available, and we are working, she just started on March 1st. We are working on identifying different facilities, places in the community where she can go and hold office hours. So if anyone else in the community who may not be involved in the criminal justice system needs help with resources or figuring out where a loved one might need to go or for themselves, can go and see her, and she can help them with applications, getting paperwork together, applying for any kind of aid that they might need to do that, setting up transportation. So we're very, very excited about that. Questions I'll have. And she's an independent contractor as well.
So she hired annually, year by year, to?
It'll be year by year because she is, we have an independent contract with her, and that's based on the grant. So we will apply each year,
Right.
we'll identify different sources of grant funding and continue to attempt to keep her funded.
Thank you.
Okay, thank you.
Okay, 4 County Health Services.
Hear me okay? Can you hear me okay now? Okay,
Yes.
all right, we're good. All right, commissioners, I see some familiar faces. Each year I come to talk to you a little bit about the 4C services. So since 1975, our name has been 4 County. We recently rebranded, and so you'll see reference to 4C Health. That's also the signage in front of the building that we occupy on the PMH campus. So this past year, we served in Pulaski County 495 Pulaski County residents for a total of 20,290 services provided. In 2018, that number was 10,000. I feel pretty good about the fact that we are at 20,000 services for this community simply because this is in the course of a pandemic. Most don't know that during the course of that pandemic, we actually lost a number of staff. Didn't lay them off, simply left because of the fear in that first year. And in fact, our skills trainers, which are the predominant workforce out in the community, in every community we serve, we ended up going down to 2. And so I point this out because I want to give a lot of credit. We have a director that works with us, Alyssa Blackburn, who made it her personal mission to see that staffing go back up, and she's been successful. We have more staff today in Pulaski County than we have ever had in our almost 48-year history of serving Pulaski County. This is predominantly made up, though, of those skills trainers, case managers, and Nicole will tell you a little bit more about the other staff. In general, we serve 40 of that 495 individuals we served in this last year. 40% were between ages 0 and 18, 7.5% between 18 and 24, 44% between 25 and 64, and about 4% over 65. But we also partner with Pulaski Memorial Hospital. We actually provide the psychiatric medical direction, nurse practitioner services, and therapy services for their senior care program, and we have for a number of years. 80% of who we serve in Pulaski County are those on public health insurance, and that really is what a community mental health center is meant to serve, is people on Medicaid, HIP, and in some cases Medicare. 63% of the people we serve in Pulaski County have Medicaid and HIP insurance, 17% Medicare. This last year, 16% had commercial insurance, and that's probably mostly people who are served in the clinic and see likely our nurse practitioner that are in the office. 51% of individuals we see in Pulaski County are self-referred. After that, about 20% come from school referrals, and then after that comes from other referrals that we may receive in the community from other providers. That may be law enforcement, that may be also healthcare, etc. So I always talk each year about admissions. So while we served 495, we also look very closely at the number of admissions we have within the course of a year, both new and readmissions. New really says that we're reaching new people, meaning never had a 4C service prior. And in this last year, of the 304 admissions that we had to 4C Health Pulaski County services, 52% of those were new admissions, meaning somebody who had never ever received a 4C Health service before in their history, but came to us or were referred to us during this last year. 48% were returning. I also like to point out that most of the time, mental health conditions and substance conditions are remitting, relapsing conditions, even just depression. If you've had one episode of depression, there's a 70% chance that you're going to have a second. If you have a second depressive episode, there's a 90% chance you'll have a third. So it's likely once that starts, right, that somebody may need help at different points in their life. One of the things I looked at interesting for each county this last year was if we look at, and we just used 2010 as a guide point, so since 2010, how many individuals in each county that we serve, unique individuals, okay, have we served since 2010? And in the case of Pulaski County, since 2010, we have served over 3,000 Pulaski County residents. Now, that does not count any of the leased services that we provide. So it doesn't include any of the people that we see through the Pulaski Memorial Senior Care and other services. Doesn't count any of the people who are not 4C clients who we've engaged in services through the mobile crisis team. Outside of that, I think the thing that I want to also highlight for you this year is, and I usually provide a little bit of this education, and I think it's important again to just highlight it, to talk a little bit about county funds, okay? County funding is something that goes towards the Medicaid rehabilitation option and Medicaid administrative match. So in the Medicaid program, the federal government sets it up and they say, hey, we're going to give you so much money, states have to put up so much money, and that's how we make the Medicaid program work. And in that particular case, community mental health centers have two unique programs that run from the feds to the state, down even touching local governments through county funding. That is the Medicaid administrative program and then the Medicaid rehabilitation option program. The MRO program is not available to anybody but a community mental health center, and that is what really ultimately is part and parcel of those skills trainers, those folks that are community-based and school-based folks. So that county funding gets counted towards, okay, in aggregate, every county gets counted towards the state, part of the state share. So in the case of the Medicaid rehabilitation option, the state kicks in part of the share, counties in aggregate kick in part of that share. And then actually, in the case of a place like 4C, where what we do in MRO is not covered actually by county funding. County funding in terms of total revenue for 4C makes up about 2% of our total budget on total revenue, okay? And so we end up kicking in order to support those MRO services in the community. Our budget in Pulaski County is $2 million. It will end up being over $2 million, and that is predominantly staff costs. It is, as we all know, an increasingly more expensive thing to employ people providing those particular services. The other thing I'll highlight, just as an employer that I've done for every other community this last year, is that our staff who have reside, so of the people who reside in Pulaski County and who have worked for us, either in Pulaski County and or worked in another community, we've about 18,000 in Pulaski County payroll taxes that came into the community. So, I like to highlight that we are a service provider. We're also an employer and one that continues to look to grow. Are we meeting 100% of every possible need in every community that we are in? No community mental health center is. Are we going to do our damnedest to continue to try to meet the need in Pulaski County? We absolutely are. We have been in this community for 48 years, and we intend to be in the community for at least another 50 years plus. And I'm going to let Nicole talk to you a little bit about the clinical services.
Yeah, so I'll just give you, I probably don't need a mic. I'm naturally kind of loudmouth, but so I want to share with you a little bit of updated information that some of you would have heard last year. And I really want to start with one of our care outcomes. We do quarterly and annual surveys with consumers who've come to us for treatment. And one of the outcomes I want to share that I'm just so proud of for all those clinicians that are providing the services, right? It really speaks to their care, is that 90% of our clients report being able to better handle their daily lives, regardless of what they've come into services for. Carrie mentioned how we've grown. Alyssa Blackburn has grown our skills trainers. We've gone from 2 skills trainers here in Pulaski to 16, 11 of them being fully dedicated to the schools, and 3 of them being fully trained as recovery coaches in our community. We continue to be in every school corporation, West Central, Eastern Pulaski, and in Culver as well, which I know touches a couple of different counties. Some of the things we're doing in the schools, in addition to the things we were already doing, such as formalized programming, having a dedicated full-time therapist in the schools, is that we've using our student support program so that it's not a cost or a barrier for students, is to expand our truancy program, to expand our substance use education program and our teen intervene program. And so students can use those, can receive that treatment or that education program through their student support program, so that cost is not a barrier. We have a partnership with First United Methodist Church, who's opened their doors and is allowing us to run, while we do have an office here, we don't have a ton of group space, and so they've opened their doors and have allowed us and are allowing us to run all of our groups, and even as we continue to expand the number of groups at the church, that's been a great partnership as well. Our outpatient clinic continues to run in a hybrid model. When we were 100% tele, when the world shut down, right, we're now part-time in the office and part-time continuing to do teleservices, which only enhances our ability to reach those who might have transportation barriers, a lot of the barriers you all see as far as resources in a rural community. We have, as Carrie mentioned, an LCSW dedicated to senior care in partnership with Pulaski Memorial, as well as an APRN, and then our chief medical officer who oversees those services. We have a therapist at Braun Clinic. We have a partnership with Braun where we are able to integrate a therapist with our health, and that program continues to expand as well. We continue to serve the jails and family treatment court. We have enhanced our peer services. We have 2 peers who go into the jail and offer groups to the male and female population at no cost to the community, at no cost to the jail. We use SAPT block grant dollars to help cover those services, and it by no means covers the entire service, but that's been a great way to kickstart our jail programming. And we just met with Sheriff Schramm and your new jail commander, and so we're excited to announce that we'll be expanding those services. And one of the things that does, right, is helps somebody who gets released from jail, right, and along with, right, having those navigation services that Judge Coker talked about, right, helps them get into treatment, right, and not have a gap in between where they might fall off of treatment. And so they can start that treatment in jail and then continue that treatment post-incarceration. We have an APRN who provides med clinic services in the office 1 day a week. And we continue to utilize our mobile crisis team here in Pulaski County. And since its inception in September of 2020, we've had 413 calls here in Pulaski County. About 76% of those are adults. About 26% of those are child and adolescents. And the good news is about 66% of those are stabilized in the community, meaning it helps to keep folks out of the jail when possible, or out of an acute care hospital setting when possible. And really the last thing I'll say is I just want to go back to, Harry and I get to come out to these and talk about the work that's going on. But again, I want to recognize the clinicians who are doing it. Many of them who live here in this community every single day through a pandemic, right, and continuing to serve our clients in our community. So I always want to make sure they get the kudos they deserve.
I want to mention one thing about the mobile crisis teams, which I think is really neat. So 4C was only one of 5 entities in the state that was selected for a state mobile crisis pilot. And those entities will actually be the first mobile providers connected to the 988 system. So you know that the state plans to further roll out when you're in behavioral health crisis that you're going to call 988. And so today, our mobile teams deploy based upon law enforcement dispatch. And in the future, a lot of that will also come directly from being dispatched by the 988 teams and call center. And so that's really exciting to hear that, that the data that we have collected and the services that we've provided in Pulaski, Fulton, Miami, and Cass for mobile is actually being discussed as a part of the data to lead the future of the 988 comprehensive system. So I just wanted to share that. Any questions?
What percent of the people, I know most of them are referrals, is there a small percent that are self-enrolled, so to speak?
Well, most of the people in Pulaski County self-enroll. So yeah, the individuals that we receive most of the time are referrals, about 51% in this particular last year, that they're just reaching out to 4C themselves and seeking help. Mm-hmm.
I do appreciate the email that you sent out earlier that had a lot of statistics on it. Need that. Have any
questions?
Okay, well, great. You always have my email address, my cell phone number, and if you ever have questions, you're welcome to give me a call.
Thank
Okay,
you.
Thank you. Thank you.
Nathan?
Good evening, gentlemen. I will be pretty brief tonight. First, Justice Center updates. We have coordinated with Judge Coker and Ton and Blank. The replacement carpeting is on order, and they expect to have it installed before the end of this month. And then the other thing we had on the Justice Center was the panic alarms, to replace existing ones, to get them all in the same system, and to install them in the prosecutor's office and the court. I got some additional information from one of the two today, but the more I review them, the more I recognize that there is not enough detail in order to make a recommendation. One of them is substantially more than the other, so I expect that we'll probably still go with the other one, but there are some missing details on one of them that makes it difficult to see if they're actually as far apart as they are, or if they're pricing different tiers of technology. So I'm going, like I said, I got the update from the costlier of the two today. I need to connect with Corson, who does some of our fire security in the Justice Center already, and hope to have that for you at your next meeting. On the housing project, we're still evaluating sites as we've assessed different suggestions, different concerns with the town of Winnemac. And then as of today, I have a meeting with an industrial development prospect scheduled, and they may be interested in that ground, which I think would probably take higher priority over. It's just a first meeting. It's a long shot. We really weren't even within the highest level of alignment with what they were looking for in a site, but other sites that probably met the on paper qualifications better for whatever reason have not panned out. So the state actually contacted my office, and we've got a meeting later this week. If that goes anywhere, that site is not going to be available, obviously, for housing development, so things are up in the air on that. And then just two other quick things I will note. Ton and Blank started up above us today. Mostly some exploratory work, a little bit of demolition. They're not diving in too deep now just because of the threat of rain and or snow later this week, but they are on site. They have begun work. And as you may remember, nearly a decade ago at this point, the county made a forgivable loan to Winnemac Coil Spring to assist with the building improvements on the former Eaton/Chesapeake building. I think this is the 9-year anniversary. And as of now, they continue to remain compliant with the job creation expectations that were set when that loan. If you have any questions, that's all I have for you. Yes, ma'am.
And since then, things have changed, and I think Nathan is budgeting something with the bond for those pictures to be, what would you call it?
We think so, yes. We don't have all the details, but preserved, yes.
And so the Historical Society will not need them for that. And they're also applying for a grant to get their own scanner. And so I would like that scanner to move over with us when we move, so that we can continue to scan documents, because we continually unearth more as we go along. And although the auditor's office is probably 90 to 95% complete for scanning, there's documents at the Quonset, there's documents in the basement of the courthouse, so I'd like for you to consider that this idea of going to the Historical Society to change, so that we can continue.
Do we need wait on your funding for that, or is it already in the process?
At this stage, there's no set budget. We just have the estimates that we're going through. But it's something that we will be able to work in there. It's not something that we're going to have to guess on, and we'll just have to get those quotations from somebody who can do that and plug that in. I don't think that anything on my end should interfere with Laura's desire to keep scanning.
Need a motion to do that with you or just? Did we?
But I'm not asking to change that now. I would like to get confirmation from the Historical Society before we do that and make sure that they're on board with this, but.
Okay. Consideration down the road then. And we have the claims as well as payroll number 5.
Okay, I've reviewed the claims. I've reviewed payroll number 5. Make a motion to approve as presented.
I would second that. Been moved and seconded. Any other discussion? Favor say aye.
Aye.
We have the approval of the February 21st minutes presented.
I've reviewed those. Make a motion to approve as presented.
I would second that. Any other discussion? All in favor say aye.
Aye.
We have conference requests. Recorder's Office, state mandated 2023 Recorders Conference in Indianapolis from April 18th through the 20th. Make a motion to approve that.
Okay, I would second that.
Discussion? Favor say aye.
Aye.
Also, the Treasurer's Office, state mandated 2023 Treasurers Conference in Bloomington, August 2nd, 3rd, 2023.
I would make a motion to approve that conference.
I would second it. No discussion. Say aye.
Aye.
And Highway Garage, Gary and Dave on pay. Have a road school conference, March 10th and 15th, to University. Motion that we approve that.
I would second that.
Moved and seconded. Other discussion? Favor say aye.
Aye.
And just a point of interest, Lois Manns will be resigning from the district, Pulaski County SWDC, taking another job on April 1st with Conservation Cropping System Initiative. He'll be in charge of 22 counties in north and northeast region of Indiana. Down the road, we will have a recommendation from this committee to approve their selection. Emphasis. Chris, you had a comment you would like to bring forward?
Yes, just real quick. Excuse me. As I told the treasurer last month, I had one of the new hires decided it wasn't very good, went back to his former job.
You want to step up to that mic so people else?
I thought I spoke. So I felt we were extremely fortunate. We ended up getting another officer that brings 3 years experience. He's a firearms instructor. He's an academy instructor. He has a K-9, certified K-9 with him. He brings at no cost to the county, absolutely zero. We don't have to send him to the academy. It's just plus, plus, plus. I question myself too. I know he has a strong working relationship with our other K-9 handlers. He likes the county. So we've hired him. He'll start immediately. With a little bit of training, we can hit the ground running. Like I said, we have no expense in him other than a little bit of K-9 I think they get a half hour a day. It's already in our budget. I've reached out to Kevin Tankersley's office, make sure we get the paperwork in line with that. And then they responded back, I need to check with our insurance, which I'll do tomorrow, make sure they're covered, and he won't be using the canine until we have all the paperwork done for that. So I thought that was a great hire. And as I told other people, they've had it's very cutthroat business right now, hiring policemen. They've had 5 other agencies reach out to him and try and get him away from us. So keep my fingers crossed that we can keep him around. Very good officer. I done some checking on him. Actually, he worked at North Judson. My son's the attorney up there, so he's a very good officer. I just felt like he needed a change, and he's coming down here. So I feel fortunate we're getting him. So I just wanted to update you on that, and I'll update the council next week.
All right, thank you. That's
Thank
really
you.
exciting.
Any comments? Okay, motion to adjourn, okay?
I have a contract with advanced imaging. They're no longer advanced imaging, they changed hands, and I can't tell you what it is. But we have 3 copier printers leased through them. It was leased from 2018, so the 5-year lease is up. And this will come to you as a decision that you need to make. I need to know how you want to handle it. Do you want me to call the representative to come and talk to you about these? Do you want the information so you can call that person? The 3 copiers are located, one in the surveyor, one at the sheriff's department, and one at the extension department.
The other copier,
Card, yes. Through the card, yes. Yes. So
lease is up.
this just for these 3 copiers, the lease is up, and so we need to know, we need to make a decision on whether to renew or I'm not sure what the other options are. I think maybe buy out or let it go back and get copies from the company. I will send you that information.
Motion to adjourn?
Yeah, no other comments. I'd make a motion to adjourn.
At